Hello everyone, I hope you all are doing really well. So today we're going to talk about altitude sickness or altitude illness to be in broader terms. So you all must be wondering why this topic came up suddenly. Since I've recently traveled to a high altitude trek in Brigu Lake, and also I'm going into another one which is a bit more difficult than Brigu Lake, which is around 16,000 feet, and Brigu Lake was around 14,000, but we didn't stay at 14,000 feet much. But in this trek, that is Chandrabhaga Glacier trek, we're going to be staying at 16,000 feet. So altitude illness is a broad term under which we're going to cover many diseases. In this episode, we're gonna be having two episodes of this altitude illness. In this episode 1, we're gonna be talking about AMS and HACE, that is high altitude cerebral edema. We're gonna be talking about high altitude pulmonary edema, that is HAPE, in our next video. We're gonna be also talking about some interesting Q&As and newer diseases which might you not be aware of in our next episode. So now let's cut to the chase. Anything above 2500 meter or around 8000 feet above sea level is known as high altitude. Going beyond or staying at this point or ascending to this point rapidly can cause acute mountain sickness. So what is acute mountain sickness? Basically, when we go up, the barometric pressure decreases, right? Due to this decrease in barometric pressure, our partial pressure of oxygen decreases and we inspire less oxygen, right? Clear? So we get hypoxemia. So to counter this hypoxemia, our body has some physiological normal mechanisms. Those are, number 1, hyperventilation. What is hyperventilation? The rapid breathing we do while we are ascending to higher elevations. We tend to increase our respiratory rate normally. Like, there's a meme also. Anyway, so this hyperventilation, what it does, it flushes out the carbon dioxide and increases absorption of oxygen into your lungs. But there is also a negative side to this. Due to this hyperventilation, there can be respiratory alkalosis and dehydration, which we need to counter with electrolytes, acetazolamide, and hydration. So coming to the next normal physiological thing is increased sympathetic tone. Due to this increased sympathetic tone, our body experiences anxiety, our blood pressure increases, our pulse rate increases, we become much anxious. This is a normal physiological change. But if this persists beyond when you take a rest, then you might be going into AMS. Now coming to number 3, very important, increased erythropoietin level. Some of you must be knowing that this erythropoietin is a normal hormone of our body which is released from the kidneys. So this erythropoietin, what it does, it increases our red blood cells. The main mechanism, there are other mechanisms also, BPG pathways and etc. But this increase in red blood cells helps to get more oxygen delivered into our tissues. So this is a good thing that is happening. Number 4, the exercise capacity decreases. Okay, so now coming to the risk factors. What are the risk factors that increases the chances of AMS? Exertion is a risk factor, but lacking of physical activity is not a risk factor. Okay, there are some hypotheses which tells, it's called tight fit hypothesis, which tells that the older people are less prone to develop AMS because as we grow old, our brain shrinks and there is enhanced intracranial space in our brain, so they can easily adapt to high altitude. It is called tight fit hypothesis. The third number risk factor is sleep desaturation. Number 4, if someone or some of us having any surgeries that irradiates our carotid bodies, chemoreceptors naturally present in our body to counteract these symptoms of high BP or increased sympathetic activity. So if anyone had any oncological procedures or neck surgeries that leads to destruction of these carotid bodies, or if someone having any respiratory tract infections, or if someone is dehydrated, these are the risk factors of developing an acute mountain sickness. Okay, now coming to the symptoms or how will you identify you're having an AMS. The first and foremost is headache, nausea. Why this headache happens? As we get hypoxic, our blood vessels, they dilate to deliver more oxygen to the brain. So due to this dilation, there is brain swelling or intracranial pressure that increases. Due to this intracranial pressure increases, there is headache, nausea. Now coming to number 2, that is increased sympathetic activity. Due to this increased sympathetic activity, you will be having increased pulse rate, heart rate, increased blood pressure. You'll feel anxious. Okay, coming to number 3, that is due to fluid retention, it will happening in your body. You will get swelling in your feet or hands. Coming to number 4, there is relative hypoventilation. Remember, not hyperventilation, which I taught you. Hypoventilation means decreased breathing. Okay, so I haven't told you what is our normal breathing rate. Our normal breathing rate is 12 to 20 breaths per minute in a normal adult. So anything less than 12 is hypoventilation, that is bradypnea, and anything beyond 20 breaths per minute is tachypnea, that is hyperventilation. Number 5 is there is impaired gas exchange, and due to this we get hypoxia. Very important. How do you check if you're having any hypoxia? If you have any pulse oximeter with yourself, or if you're using any good smart watches that measures your SpO2. If anything less than 88, that means you're going into hypoxia. And if this persists severely, or if it falls badly, then my friend, there are chances you might be starting to develop HACE, that is high altitude cerebral edema, and which is a bad thing. Let me tell you a story. There was a mountain climber, to be precise, Mount Everest climber, who had an episode of HACE during his climbing. After 9 months, when he had an MRI, there are posterior cerebral swellings on MRI. After 9 months, can you imagine the swelling hasn't been reduced? So I'm not frightening you, but you need to take precautions while you go to any high altitude treks. Very interesting fact is that why we wear caps or hats while we trek. So caps and hats protects our head from getting excess heat due to sunlight exposure. And there is excess heat, or we feel very warm, our blood vessels dilates and we sweat a lot. So same thing happening inside our brain. So there are chances you might be getting any vasogenic edema, or chances of HACE accentuating. So that's why wearing caps or hats during daytime hiking is a must. Let's cut to the chase again, coming to prevention and management of AMS and HACE. So prevention, we all know that we have to climb slowly and acclimatize. We have to start our acetazolamide course from day 0 till day 3. If symptom persist after day 3, then we should have to start this acetazolamide course again, and if not, then we can stop it. Remember, the first thing you do is always consult your trek leader, and if possible, if there is a doctor available, consult with him. So coming to the management or treatment part, consult your doctor first, of course. This is not a medical advice, this is, I'm telling you. Do not ascend further. Treat with acetazolamide. Descent if symptom persist. Use low flow oxygen if available. Treat with dexamethasone. It's a life-saving drug you should carry, and consult your doctor before starting your trek. And I will see you in the next episode with some more interesting diseases and very interesting question and answers. Bye. Take care of yourself. Have a safe journey. Have a safe trek.